Hello everyone, so welcome back to our lecture series on cryotherapy. My name is Priya Singh Rangey and I'm an assistant professor at the LG Institute of Physiotherapy, and you have been watching my lecture series on cryotherapy. This is my last video on the lecture series, and today we'll be discussing about the indications, contraindications and the precautions that we need to look for during the application of cryotherapy. So let's begin with the indications. So what are the indications, or what are the different pathologies where we can use cryotherapy? Cryotherapy can be used for acute injuries or inflammation, because as we have discussed in the physiological effects and the therapeutic effects, cryotherapy can help in reducing the amount of swelling, reducing the edema, repairing of the tissues, and also it can help in relieving the pain that is usually associated with acute injuries and acute inflammation. It can also be used for acute, chronic or post-surgical pain, like we have discussed earlier in the physiological effects and therapeutic effects. Cryotherapy has a huge impact on the amount of local tissue blood flow, the nerve conduction velocity, the tissue repair, the inflammation, etc. All these different therapeutic effects ultimately lead to a reduction in the pain, and that is the reason why cryotherapy can be used for acute pain, chronic pain or post-surgical pain. It can also be used for preventing edema formation, as we have already seen. Edema formation or swelling is usually associated with acute injuries or acute inflammations, and cryotherapy can help in preventing this edema formation, because it causes local vasoconstriction that will limit the amount of blood supply that is coming to the affected area. Since there is a reduction in the amount of blood that is coming to the affected area, ultimately there will be less amount of fluid that is collected in that particular area, and hence reducing the formation of edema. It can also be used prior to or in conjunction with rehab exercises. We usually use cryotherapy before applying any kind of techniques that may cause pain. It can also be used in order to reduce spasticity, particularly with neurological patients, when excitatory cold application method is used. So it can be used for both orthopedic patients, neurological patients. It can also be used for cardiovascular patients before giving them cardiopulmonary rehabilitation before they start exercising, so that it increases the muscle function. And it also is helpful in relieving pain, in relieving inflammation, and hence it can help in improving the range of motion, improving the performance of the muscles during any kind of exercise. It can also be used for relieving spasticity for neurological patients, as we have seen in my video on techniques of application. Cryotherapy can be used by the method of excitatory cold for reducing spasticity. When we are applying cryotherapy, or when we are applying quick cryotherapy, ultimately we are trying to stimulate the muscles that have been inhibited because of paralysis, and because of this what happens ultimately is that there is a reduction in spasticity and we are improving the muscle function. It can also be used for acute or chronic muscle spasm, with all the different changes, with all the different effects that we have discussed, that it reduces pain, it improves muscle function, it reduces edema formation. Ultimately what is going to happen, the amount of pain causing metabolites that are being accumulated in any muscle, the main reason for which there is spasm or soreness in the muscle, is eliminated, and because of that there is a reduction in the acute or chronic muscle spasm. It can also be used for neuralgia, like we have seen in the physiological effects. Cryotherapy can lead to a reduction in the nerve conduction velocity, and ultimately it also increases the threshold for pain. So it can be used for neuralgia, because ultimately here also we need to think of the pain and the nerve conduction. The nerve that is being damaged is going to conduct the pain impulses. If you are applying cryotherapy, then it is going to inhibit the conduction of those impulses. So these are different indications of cryotherapy. Next, moving on to the contraindications. In contraindications, the main contraindication for cryotherapy is any pathology where there is going to be impaired circulation, because we have seen in the physiological effects, that cryotherapy leads to Lewis-Huntington hunting reaction, where there is a hunting between finding the optimum temperature or the optimum state of dilation or constriction. So in order to move between those two different states of vasoconstriction and vasodilatation, the most important thing that is required is efficiency of the blood vessels to dilate and to constrict. If the vessel is impaired, if the vessel is not able, the smooth muscles are not able to contract and relax on their own, ultimately the circulatory compromise is going to lead to damage to the tissues for that affected area. Hence, any pathology that has any kind of circulatory issues which leads to circulatory insufficiency is a contraindication for cryotherapy. With deep vein thrombosis also the problem is the same, as we have seen that in cryotherapy there is a reduction in the local blood supply because of vasoconstriction, which is for a lesser amount of period, but still we can see vasoconstriction which is then followed by vasodilation, and again a cycle of vasoconstriction, and so on. With this changing of state from vasoconstriction to dilation, ultimately we are talking about arterial blood flow and venous blood flow. Arterial blood flow is something that takes the blood to the tissues that have been affected, and it is going to bring in warm blood, and the venous route is going to take the cool blood away from the tissues in order to maintain an optimum temperature for those particular tissues. If there is any impairment of the venous supply, say because of deep vein thrombosis, then the vessels might not be able to take the cool blood away from that particular area, and the cool blood will keep accumulating in that area itself, hence reducing the temperature of those tissues more than what is required therapeutically, which may eventually cause damage to those tissues because of frostbite or because of any kind of cold induced injury. Hence, deep vein thrombosis is also a contraindication for cryotherapy. Cold sensitivity: when applying cryotherapy in a patient who has cold hypersensitivity, it may give a histamine like reaction which can cause rashes, it can cause hives, itching, etc., and hence it is contraindicated for cold hypersensitive patients. Altered skin sensations are another contraindication, because whenever we are applying cold, we need to have feedback from the patient. If the patient is not being able to perceive the sensation of hot or cold, the patient will not know what the temperature the patient is feeling, and sometimes it may cause damage because the patient will not be able to give us a feedback that the patient is feeling more cold. Advanced diabetes usually is associated with damage to the nerves, and this damage to the nerves can cause altered skin sensation, it can cause altered temperature regulation for that particular area, and hence advanced diabetes is also a contraindication for cryotherapy. Chronic wounds and open wounds usually are associated with a lack of blood supply to that area, and sometimes also related to infections, hence it is also a contraindication. Peripheral vascular disease, like we discussed with circulatory insufficiency and deep vein thrombosis, any pathology which causes vascular compromise is a contraindication. Even with peripheral vascular diseases, there is going to be a vascular compromise to the affected area, and hence it becomes a relative contraindication. For vasospastic diseases, usually following cold exposure, there is some or the other form of cyanosis that is seen, and this cyanosis is usually because of the vasoconstriction that occurs because of cold exposure, and it is much severe than a normal reaction, and it may also lead to the loss of that particular area because of gangrene, and hence vasospastic diseases are also a contraindication. In cryoglobulinemia, there is aggregation of proteins. This aggregation of proteins might lead to some or the other form of clots that may be formed, or they may restrict the blood supply that is going to that particular area, and ultimately this occurs because of cold exposure. Hence, cryoglobulinemia is also contraindication. The same kind of findings are seen in hemoglobinemia, where the clot may be formed because of aggregation of the RBCs, since there are excess RBCs that are seen in hemoglobinemia, and hence both of these conditions are contraindications. Cold induced myocardial ischemia may also occur sometimes when we are applying cryotherapy to large areas, because there is a reduction in the blood supply to most of the areas, and that ultimately creates an impact on the heart, and hence it may also lead to myocardial ischemia. Any form of psychological disorders, if the patient has, the patient may not be able to cooperate with the therapy, the patient may not be able to give us feedback about the temperature that the patient is feeling, and hence psychological disorders are also contraindications for cryotherapy. Next, moving on to the precautions. We need to be cautious whenever we are applying cryotherapy to certain areas, but if it is required, if cryotherapy is required to be allowed in such areas, then we can use an insulating medium between the cold modality and the surface of the skin. When we are using this kind of an insulating medium between these two structures, that is the cold modality and the skin surface, the effectiveness of the cryotherapy is reduced, because we will not be able to gain the temperature that is required, but it may be required in order to protect the tissues which may be vulnerable. We need to be cautious when we are applying cryotherapy over the carotid sinus, over areas of infection, when we are applying it near the eyes, or we are applying it for treatment of large areas, especially in individuals with cardiac involvement, respiratory involvement, or hypertension. So these were the indications, contraindications, and the precautions that we need to consider when applying cryotherapy. For further reading, you can use these two great books, Clayton's Electrotherapy and Therapeutic Modalities. These books have explained cryotherapy in a lot of detail. And with this, I conclude my lecture series on cryotherapy. Hope I was able to give you all the information that is required. Thank you.